Hello, everyone. Good evening, good morning, good afternoon, depending on when and where you're watching this Facebook Live. Dr. Labinton, I help people live long and well because I believe the quality of life is just as important as the quantity of life. If you are watching live, you know the drill. Hashtag live. If you're watching replay, hashtag replay. I'm so excited to have on this impromptu, amazing Thursday evening Facebook Live or YouTube Live or live stream on the topic how to keep your bones strong. My guest is very entertaining. So if you know somebody who should be on this show or who should be watching this because you want to help them prevent a fracture, you're worried about them falling and all the things, I strongly recommend you send this link to them, you tag them, you do the things to get them on. We will be answering questions live. I am honored and delighted to have Dr. Ariola Dada, who is a board certified rheumatologist and clinical. She's board certified in rheumatology and clinical densitometry as our guest. We've had her on before, I think twice. Let me bring her on. She's a ball of energy. You can see the smile. Good to see you. Good to see you.
Thank you, Dr. Labinto. I love your show. You know that, right? So thank you so much for having me. And hi, everybody.
All right. Awesome. Awesome. Thank you so much for coming. Now, Dr. Dada, I want you to kind of brag on yourself a little bit.
Okay.
You know, who you are. I know you've been doing this well over 20 years. I didn't mean to age you. You look great. She's been doing this for over 20 years and she's gone to school for a while.
Yeah.
So could you tell us a little bit about who you are, what you do, and why you do the things that you do?
Thank you so much. Yeah, it has been 20 years, but pure joy. Totally love what I do, love my patients. So, my name is Dr. Aminola Dada. I'm a rheumatologist. So, I help people with joint pain and autoimmune disease. So, I help the people with joint pain become pain free and people with autoimmune disease get their immune system back on track. And since we're talking about bone density, I also help people make sure that we maintain good, strong bones. And in summary, the result of all this is to have people have healthy, active, happy lives. That's what I do.
Awesome, awesome. I love that you do what you do. We're getting a lot of shout outs in the text. Dr. Una, good to see you. Okay. All right.
Ah, Dr. Una.
All right. So we're talking healthy bones. People are probably wondering, okay, why should I care about bones?
Ah,
What we're talking osteoporosis. What is that?
yeah.
Why should I care? Doc, what is that?
Okay. So osteoporosis is a condition where the bone mineral is not as dense as it should be and basically results in fragile bones. And the story of osteoporosis is a silent, can I say killer? Silent
Mm,
killer,
mm,
because you don't actually know that you have it until something bad happens, like it breaks, right? So I had a patient the other day. She's 86 and she told me, she was recently found to have a low bone density. And so she's looking at me pretty frankly and saying, hey, they're telling me that my risk for breaking a bone in 10 years is, X, And she's like, well, who cares about 10 years? I'm like, girl, you're going to live to 106. Your brain is sharp. You're playing with your grandkids. In another 10 years, there's so much you're going to still be doing. We are all living longer. And the important thing is that we want to make sure that we are healthy, that we have good quality of life.
mm.
Nobody's sitting on the porch. You know that. Nobody's sitting on the rocking chair in the porch anymore. People are active, they're hiking, they're doing things. So when I explain to them and say, hey, we want to make sure that you don't break a bone suddenly, because if you do, you don't just, when you're 20, you break a bone, you put in a cast, you drag it along, doesn't really
Mhm.
matter. But when you're in your 80s or 70s, you break a bone, you end up in a nursing home. Your life is never the same. You may never, 50% of people don't get back to their previous independent state. I got her attention there. She's like, yeah, let's talk about this. Yeah, because she didn't want to be in a home. She's living independently in her own home.
Mhm.
Grandkids come over. She wants to keep that up. So it's a silent killer. Like you don't know it's happening until snap, it happens,
Mm.
and you
Now,
break a bone.
are there ways to kind of figure out well, not ways, like risks? What are risks for having thin bones? So for someone who's
Yeah,
like, okay, I understand. How do I get to the point where I don't get to osteoporosis, or how do I limit it? So first,
yeah.
let's talk about risk. What are risks for developing thinner bones?
So sometimes it happens in families, right? And sometimes it's even races. So some races, whether it's Asians or Caucasians, are more likely to develop osteoporosis in women. So being a woman is increases your risk, because once we hit menopause, estrogen has been basically helping us build our bone. But once we hit menopause and we no longer have that estrogen, that generalized body estrogen, then we start to lose bone density. So once you hit menopause, if you're a woman, if you have a family history, if mom has osteoporosis, but sometimes it's actually things that we're also doing to ourselves. Are you a
Mm.
smoker? Just don't smoke, right? Alcohol. Alcohol in moderation supposed to be like 6 to 8 ounces. And just for occasionally. But if you are drinking alcohol and you know that it's an issue, it's probably also bad for your bone density. Certain medications, like, in my world, I use a lot of steroids to treat conditions. Well, from the day one,
Mm.
I'm always thinking, what about this person's bone density? And then finally, like anti-seizure medicines.
Mm.
People have seizures and they have to be on medications to control it. Well, those things can also increase your risk of having low bone density or osteoporosis. So those are the things that put you at risk for osteoporosis.
Okay. Are there things that are preventable? So we know we talked about the medication. I mean, you're steroids to treat things that could cause pain, and those help. That's one. We talked about genetics. I mean, that you can't undo. We talked about smoking. I guess you could do cut down smoking and limit
Yeah, stop
alcohol.
stop
But
doing that
but
actually.
are
Stop.
there ways to protect our bones? Any lifestyle tips for us, doc?
Oh, definitely. A whole lot. Actually, none of the medications work if we're not doing the lifestyle things. So,
Ah.
first and foremost, walking, the weight bearing effect on the ground. I'm not saying running. You don't have to go running and you don't have to go start running marathons. Just start walking 30 minutes a day. And you can even start with 5 minutes. Five, go to the mailbox, come back home, right? And then you gradually add to it. So 30 minutes of walking a day is a minimum and so it's not about speed, just as long as you're taking those steps, the steps on the ground. There are a lot of other exercises, but as long as your feet are not touching the ground, you're not really getting that benefit of gravity, then you're not really strengthening the bones,
Mm.
right? So that would be the number one thing that could be done. There's always diet and supplements. Calcium and vitamin D are very important for bone building. So making sure that your diet, exercise, I talked about that. The other part of exercise, honestly, is strengthening. And a lot of times people say, how does strengthening improve your bone density? Well, one, if we think about it, as we get older, one of the major reasons we break a bone is because we fall. So if
Mm.
we're strengthened, we can
Mm.
actually have better reflexes. And so we can actually prevent that fall. If you see a bunch of 20-year-olds walking out of the grocery store, singing songs, playing on their phone, whatever, they trip, but they don't fall. They catch themselves. You know that a 70-year-old woman, all she's doing is looking ahead of her. She's not getting distracted. She's the one that is going to fall because her reflexes are not good. But strengthening the muscles, keeping the ligaments and tendon tight, actually improves our dexterity and allows us to catch ourselves, and so that we can minimize the impact or minimize falls. So strengthening for multiple reasons, but in addition to prevent falls and also increase our muscle mass. So we're sturdier, right?
Mm.
Because if you have a little cushion between your butt, your bone, your pelvic bone and the floor, perhaps that can add a little bit of a bounce rather than you have your bone and you have the skin and then you have the ground. There's no shock absorber, right? So strengthening is important, walking is important, and then diet.
I like it. Get yourself a shock absorber, she said. That's what I heard. Get yourself a shock absorber. I heard that in the place of exercise. I love it. I love it. Now, Doc, you said vitamin D. I
Yes.
had people say, "Oh, vitamin D3, vitamin D2. What D? What vitamin D? What do you generally subscribe to or recommend for patients when it comes to vitamin D?"
I typically, first of all, depends on how low their vitamin D
Okay.
levels are. And so I'm in Seattle, right? We only get sun 3 months of the year. So I typically recommend vitamin D3.
Okay.
And the level of supplements honestly depends on what the person's baseline in. You are out in Texas, it's sunny 365 days a year. And so the body's ability to metabolize and process vitamin D may be different, but darker skin may not be able to process vitamin D as well.
Mhm.
So, still important for us to check the blood levels and then determine what level of supplementation people need. Out here in Seattle, we all kind of need a little bit of vitamin D just to keep us on maintenance level. So here we're taking between 2,000 to 4,000 international units of vitamin D. But even just the vitamin D in the multivitamin sometimes is adequate if you're in kind of a sunshine state like you are.
Okay. Now, I have patients who, or clients who diagnosed, they go for the bone density scan, they get the result. Oh, it shows osteoporosis. Oh my gosh. Oh, I don't want to take the medicine.
Yes.
What would you say to that person who's like, I don't know, I don't want to take the medicine, there's side effects, I don't like taking
Yeah.
medicine.
You're
What would you
right.
say to that person?
You're right. Yeah. So there's a time, when you have osteopenia where the bones are less dense but they're not
Mm.
high risk for fracture, then that's when everything that I just said is adequate to do, and then recheck the bone density test a year later.
Okay.
But by the time one has osteoporosis where the bone is at high risk for breaking, and the patient I saw the other time, her bone density, the T score was minus 3.5. And just to give you an example of T score of -1 is good. -1 to -2.5 is osteopenia. Anything worse than 2.5, like -3.5, the higher it's minus, right? So the higher those numbers look like, -3, -3.5, the higher the risk for breaking a bone.
Mm.
So, and so sometimes people say, well, I don't want to take the medication because, well, I haven't broken my bone yet.
Mm.
But the problem is that once you break the bone, right, you could say, well, then I'll start taking the medicine. But it takes a while to build the bone
Mm.
because your number one risk after breaking one bone is to break another and another. So my visual for people, that's I told her that. I said, if you think in your mind's eye of like this 70-year-old woman, she's trying to cross this street, but she's kind of bent over, like she can't really raise her head up. And I think we
Mm.
all have an idea of that person. That's because she's had multiple compression fractures. And you can think, well, compression fractures, well, that means she broke her vertebrae in her spine. And you say, well, you have to be thrown off a horse or something for that to happen. No, you could have osteoporosis and you could have a little tickle in your throat and you could cough and then snap. You broke a
Wow.
vertebrae because it's so thin. And once you break one, your next risk is the one under it, right? So it's almost a race at that point. So finding out that one has low bone density is a blessing because you can treat it and you can improve it before you become that woman that coughs and breaks her vertebrae. So, of course, right, medications have side effects, and that's true. But the important thing is that these medications have been around for decades. We know
Mm.
everything that those medications do, and we can get the benefits and avoid the risks, right? So some of those medications, the Fosamax, the biphosphonates, they're great because they help to build bone density, they peel, um, they really don't tend to cause significant side effects unless you've been over on them for over a decade. And those side effects, people talk to me about all the time. What about that thing in your jaw and that thing in your hip?
So my
They
closer
do
here.
happen. The avascular necrosis of the jaw or the atypical hip fractures. They are not common in people. First of all, they're not common at all. Then they're even less common by people than people who are taking the pill. If you're taking the intravenous form for other reasons, then there may be a higher risk. And so we reduce the time of exposure. So we try to get all the good stuff. And then we know the longer you've been on it, the higher the risk for problems. So we kind of minimize how much time we encourage you to be on the medicine. And so
Mm.
we use time to kind of minimize the risk of some of those side effects.
And you encourage the movement because even with the
Oh,
osteoporosis, yes, you still
yeah.
move.
Oh, yeah. If you don't move, the medication is invalid. It's not does not work. Right. So people who are like wheelchair bound, we have a very difficult time, even with every single medication. So we need people to move. A little bit of movement, just start. Start where you are. Zero comparitis, right? Just start where you are and just, take the steps, improve by 1% a day. You will be amazed how much you can do.
I like it. And people have had their osteoporosis reverse.
Oh, yes. Oh, definitely. That's the whole point. We want to improve your bone density to a point where your risk for breaking a bone is minimal so that you can live an active, healthy life, right?
I love it. I love it. I love it. Could you tell us maybe some common misconceptions about osteoporosis that you would like to clear up? I would hint for one, oh, osteoporosis, osteoarthritis,
Mhm.
arthritis, porosis.
What is
What's
that then? Yeah,
uh-huh.
I can help. So osteoarthritis is arthritis, and so that's the joint. So wear and tear in the joint, right? That's osteoarthritis. Osteo is bone, arthritis is anything going on with your joint, and they're like 20 different kinds of arthritis. Osteoporosis is actually looking at the quality of the bone. What is it going to take to snap that bone? So when a person has osteoporosis, it means that that's the example I gave you. Cough, you break a bone. Under normal circumstances, if you cough, you should not break a bone. Other examples that osteoporosis is you're walking and somebody just slips on water in the floor and falls and breaks a hip. That is osteoporosis. Now, if we all bungee jump and we fall, if you fall from the roof of your building, that's from a height. That is not osteoporosis. Or you get thrown by your horse. That is not osteoporosis, right? And we would need a bone density test to confirm. But when you're just walking on the ground level and you fall, and it's not an accelerated injury, right? It's just a fall from just the horizontal level. That is osteoporosis. So it's thin bones. And the thing about those thin bones is you don't have any symptoms. So you don't even know you have it. So people say, I have osteoporosis in my right hip. It hurts. No, there's another reason why it's hurting. It doesn't hurt until it breaks.
Mm, 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 mm. Um, Thank you so much. A lot of useful information here. We're learning about what osteoporosis means. We know that it's a potential silent killer. We know the risk of broken bones, being in the hospital, having a block wad, and the complications that come with that. We know that it's preventable, it's treatable, but you got to get tested. For someone who's watching, well, it sounds like this is for old people. Doc, when would you say, generally speaking, people should start asking their doctors to get screened for osteoporosis, both men and women?
Any woman over 50 should at least get a baseline bone density because what happens at the age of 50, 60, 70 is that somebody finds out, oh, I have osteoporosis. Well, maybe we could have at the age of 50 just getting a baseline and just said, okay, well, this is a great time. The bone density test is inexpensive. This is a great time to, why don't we focus on nutrition, on exercise, on moving more? And then we can really kind of get into the preventative part, right? I think strict guidelines, anybody at 60 should definitely, any woman at 60 should definitely get it. But at 50, because an inexpensive test, totally makes sense to do that for prevention. Now, of course, if you're smoking, you shouldn't do. You're drinking a lot. Don't do that. You're on steroids by your rheumatologist, right? Or, you're seeing a neurologist for anti-seizure medicines. Those people should also get bone density tests, right? Just so that, if things need to be done, they can be addressed, right? For people that have autoimmune diseases, that's my world, right? People with rheumatoid arthritis or something
Mm,
called ankylosing spondylitis,
mhm.
they need to get bone density tests, at least to begin with. Even something called lupus, they need to get a bone density test. But I wouldn't, so not a lot of guidelines for people less than 650, but more guidelines for people who are above 50 and above. Men, any man at 70 should get a bone density test. Now, people who are, like I said, if they're on steroids, they smoke, they have rheumatoid arthritis or lupus, ankylosing spondylitis, they should at least get a baseline at the beginning, right? So those may be hopefully things that are helpful to people. But I think standard of care would be 60, definitely every woman should have at least have had one, and 70, every man should at least have had one. We tend to be very lax on the men because they
Yes.
don't have a high incidence of osteoporosis, but that's actually standard of care is that 70-year-old men should be getting at least one. and then we can prevent, because we know the consequences. They break a hip, somebody says, ah, you have osteoporosis. Well, too little too late, because now they're in the nursing home instead of golfing with their bodies.
Mm, mm. Wow, thank you. There's hope. We come a long way in medicine. There are ways to treat. We got to catch it early. It's all
Catch it
about
early.
preventive care. That's why you should
It
go see your
is.
primary care doctor, get your screening tests, and if it's positive, we send you off see Dr. Dada. You get your medicines. You do the things. You move the movements to help strengthen your bones for a better quality and quantity of life. This has been very helpful, Doc, and I'm sure people are watching. Like, hey, does she have content? Doc, do you have content that you share on osteoporosis and other topics
Oh,
that we should be aware of?
definitely. Oh, definitely. So we have a YouTube channel called Healthy Joints, Healthy Life with Dr. Dada. You can also Google me at Dr. Dada, Healthy Joints, Healthy Life, and you find a YouTube channel. We're also on Facebook at Dr. Dada, and also at overlakearthritis.com. So multiple places on media to find us. But I think we even have a number of interviews with Dr. Labintan on our channel. So yes, and we have our podcast too, Healthy Joints, Healthy Life.
You started a podcast? I didn't know that.
Oh yes, I'll send you the link. We have 49 episodes. When I get to
Oh,
50, I was gonna have make a big
okay.
blah about it.
Good to know. Good to know. For those of you who are watching, we've put it in the contents. Thank you so much, Jeremy, for doing so. She's put it in the content so we can or the comment section so you can look at it. Please be informed. We're in the age of medicine now where it's good for you to know what tests are due you, what screenings are due you, so you can go to your doctor and say, "Oh, I'm this age. I'm told I should get screened. It's something my insurance should cover. I'm ready." All right. So
Yes,
please watch. These resources are for your use,
they are.
and I love the lifestyle piece to things you can actually do to help
Definitely.
minimize the.
There's a lot you can do.
Yes, yes, yes. Thank you so much, Jack. This was fun. Thank you.
This was fantastic. Thank you so much, Dr. Olabintan. Appreciate you having me on.
My pleasure. My pleasure. Anyone have questions? We have a few minutes. Any questions? We're here for you to answer them.
Too
If
much
not,
fun.
if not, we're done. This has been good. Please share as always with people in your world who could benefit from this live. We'll definitely have Dr. Dada come back again. Maybe we'll talk about ways to prevent fractures. We talked about osteoporosis, but maybe fall preventions and things like that, or even gout. We could talk about gout too.
Yeah, lots of things to talk about.
So many things to talk about. So thank you all for watching. You can always catch the replay as well on the different channels. And as always, if you or anyone you know is looking for an awesome, a thorough, a compassionate family physician in the Mansfield, Texas area that will help you live long and well, you know it. I am she. Have a good one, everyone.
Have a
Bye.
good one. Thank you so much.
Thank
Bye
you,
bye.
Doc. This was good.
Bye.